This is the Whiplash Session our host today, a doctor of chiropractic, Dr. Gerald Lala, and Dr. Richard Jensen, who is also a board-certified acupuncturist, practice independently in Norfolk, Minnesota. Let's join our host for today's program.
Welcome to House Call. I'm Dr. Gerald Lala.
And I'm Dr. Richard Jensen.
It's good to have you with us again. As it says on the screen, if you're watching us on television, Whiplash Causes and Corrections, Session 1. So that must mean that there is more than one session. And as doctors of chiropractic, certainly you could assume that we do see a lot of people have been involved in whiplash-type accidents. The whiplash-type accidents have many causes, and so we're going to look at them now. And those causes involve certainly automobile accidents, falls, and jars. And we're going to also discuss the fact that of what commonly occurs in a whiplash-type accident, and then Dr. Jensen is going to discuss that now.
Okay, well, what commonly occurs in a automotive accident is that the force is generally in a rear end. We see a lot of that with that the force is from the rear of the car, and what it actually does, as you can see in that graphic, the body moves first and the head is left behind. And so the head, neck, upper, and lower back are thrust backward and then forward in a whip-like action. And the spine always goes to the force and then whips forward. And that's part of the principles of physics. We could roll this video that we have that shows more of this, and it's really a problem of inertia. Inertia is that an object in motion tends to want to stay in motion, and an object at rest tends to want to stay at rest. So in this case, if you look at the grid there, see at the beginning of this accident that the head, though the car is moving, the head is in the same spot until all of a sudden it catches up with the back of the car. So first it whips backwards and then is pushed forward. And as you see on the bottom there, 4 mile per hour impact ends up with a 5 mile an hour post impact. And that's due to, here, we'll look at the sunglasses, see where the whipping action takes place at the back here. Those sunglasses, you can see the shadow in the back. Those glasses, you'll start to see them in a moment, get flipped into the back seat. There they go. What happens is because of the impact is an inelastic collision, and meaning that the bumper, what you'll see in here in a little bit, is not damaged. The bumper was actually compressed and then bounced back to its regular form, and therefore it accelerated the car faster than what the impact was. Here you see there's no damage to the back of the car, and so a lot of times you'll see an auto accident that there is no damage to the car. And the reason that can actually be worse on the occupant of the car than if it was okay. Here all of a sudden we have a 9 mile an hour accident, and you can see the acceleration post impact is even worse. It's 11 miles per hour. And again, it's all about inertia. That head wants to stay there until it's acted upon by forces exterior to it, and that force is actually either the seat rest there or that the body is moved far enough forward that it's pulling the head through the neck, in which case we're causing cervical injury in that case. See, the ear stays in the same spot until all of a sudden, boom, at the back there. So what we have is this is where a lot of cervical injuries take place. We have stretching of the soft tissues around it, as well as sometimes you can have deformation of the bones within the neck. Here we are again. We're looking at the bumper, and the bumper has no damage to it. So as we go back to our slides here, we're looking at if the force is from the back, that it's snapping the head forward, and then when the car comes to rest in front, it snaps the head forward again, as we see in this graphic, and that's why you get damage to the front and the back of the neck. And then if the force is from the side again, if we come to me, on here, if I got hit from this side, my body would start to move, my head wants to stay in place, and then finally when it stops, when the body stops or it starts to pull along the head, then it'll whip this way, so you get damage to both sides. And one of the problems with that is, and we see this in auto accidents, that a lot of times when people are hit from the side, they tend physically not to feel as bad initially, but the vasculature that is between the brain and the skull is more susceptible to sideways hits, so there we're more susceptible to bleeding up in the brain, and many of those people, they feel fine until like 3-4 hours later, where they collapse into a coma, and therefore they should, it really behooves you to be checked out if that's the case. Now, if the force is from the front again, from the rules of physics, rules of inertia, these are Newton's laws of physics, that a force, if the force is from the front, first of all, the body is being pushed backwards, and the head planes come along through the neck, so that the head, neck, upper and lower back will be thrust forward and then whipped backward in whip-like action. So we tend to be thrown in the direction of the force initially, and then when the car comes to a rest, or when things come to a rest, we're thrown the opposite way, and therefore there's usually injuries to both sides. As we looked in this video, that a 4-mile-an-hour collision ended up in accelerating the car actually to 5 miles per hour, and again from the 9 mile an hour to 11 miles per hour after post collision, we have that the degrees of force of 5 to 10 miles per hour force can cause spinal injuries. And we look at that from how those glasses, you could see the forces on those glasses, that they didn't have the neck pulling them along and so forth. They were free. They actually yanked them off the head and threw them in the back seat. So you can tell that there was a quickness to the force. And that's the whole idea, is usually with protection like the airbags, that's to slow down that force. And so then we had to look at elastic versus inelastic collisions. And the elastic collision is that when you deform something, it pops back to its original shape. And inelastic is like with clay. You push your thumb into it, and it stays deformed like that. And so what they're looking at is, in some cars, they're made to collapse to take that force in there and keep that from the passenger. But as we look at some of these cars where it's an elastic collision, where the bumper has been hit, but there is no mark on it afterwards, it returned back to its original position and therefore transferred all that force through that car and through the passenger. So many times these small or slow collisions are just as bad as the fast collisions, the ones in which there is great damage to the car, due to it being an elastic collision rather than inelastic collision. So as we look forward from that, let's look at seat belts. Dr. Lala, what about seat belts?
Well, with reference to headrests, lap and shoulder belts, certainly it's good law that they're required. It's actually speed that kills, and the higher the velocity at point of impact, certainly the greater the potential of injuries. But seat belts and lap belts, shoulder belts, and headrests may actually accentuate injuries to the head, the neck, shoulders, the ribs, and other soft tissues. A good point of interest here is that when a couple or two people, for example, in the front seat of a car, have been involved in a rear-end collision, they often present with mirror image symptoms. The driver will have a shoulder issue, and the passenger will have a shoulder issue on the opposite side. The driver may have a lower back issue on the right side, and the passenger may have issue in the lower back or pelvis on the opposite side. So now let's talk about some of the long-term effects of whiplash-type injuries. The absence of pain. This is very important to recognize this, that the absence of pain does not necessarily indicate the internal presence of wellness. Very often there is a rush to make a financial settlement if that's possible. That's understandable. Some people are oriented to that way. They're more litigious in nature, or they just want to make some money quicker. Sometimes attorneys and doctors involved are that way too. And then thirdly, many whiplash injuries are not treated, or when treated, are treated incorrectly, predisposing the victim to chronic back and neck problems. That very often involves when a comprehensive postural, physical, orthopedic, neurological, and acupuncture meridian evaluation is not conducted. So now Dr. Jensen is going to look at sprain, the symptoms that are most commonly or more immediate when there has been a sprain. And there is a difference between sprain and strains, right?
There absolutely is, Dr. Lala. So we're looking at sprain symptoms are usually more immediate. This is where muscle fibers, ligaments, and tendons are torn. And a sprain is normally with the ligaments and tendons where they are torn. And the trauma is caused to these soft tissues, sometimes to nerves, arteries, veins, lymphatics, and acupuncture meridians, just from a trickle-down type of injury where you've caused congestion in the area. Now, when we look first at the ligaments being a great cause of pain, one is that ligaments heal very slow because there's not a lot of blood supply to them. And what we're looking at here are just the ligaments that are within the spine. And looking at that, we have the anterior longitudinal ligament here, which follows across the front of the spine. In case of where the head is whipped back like that, if this is in the neck, we could have a lot of stretch and some tear that occurs in here. And the thing about ligaments is that they are highly innervated for pain. Highly innervated for pain, and therefore a source of pain after the accident. A source of pain that can extend for long periods of time. Then when you whip the head forward, you can cause a stretch to this other ligament here, which is a posterior longitudinal ligament, which is actually found within the spinal canal. And swelling in there can actually push upon the spinal cord, especially in the neck where, or at the bottom of the neck, right where the neck and the top of the body come together. That's where there's a thin area to this canal here. It actually gets thinner there. We have the facet capillary ligaments. So if you have facet syndromes and things like that, these ligaments here may be affected. So we have ligaments throughout the spine, lots of ligaments all through there that are all highly innervated for pain and can be a source of long-lasting pain after an accident. Let's go on to the next here. For a strain, strain is normally muscle tissue. And here we're looking at muscle tissue here from a whiplash type of action, and where we can have a cause of stretching within the muscles at the areas here right below the mastoid process, right by about C1 here, which is the top vertebrae in the neck. So people end up with a lot of headaches from this area here, as well as here's the vertebral artery going up into the head. This is actually a large blood supply to the brain. If we look at this, that we can also have a strain of the sternocleidomastoid here. We can have strains to, or actually look at the ligamentous structures here, where that can be damaged also in this area. Dr. Lawler, did you have something that you were going to mention?
And that attaches the distal end of the sternocleidomastoides attaches onto the clavicle, correct?
Right.
So they could have sternoclavicular issues.
Correct.
Or acromioclavicular issues, so clavicle or scapular or breastbone issues as well.
Right, right. So when we talk about the collarbone and the sternum, which is the bone in the middle of the chest, as well as what Dr. Lala was talking about was acromioclavicular, that's a joint that's way out at the tip of the shoulder. So people can have shoulder pain from this as well.
Or shoulder injuries without necessarily being in a symptomatic perspective, right? So
right.
A lot of times we can have symptoms, or there be an absence of symptoms, but still an injury.
Correct.
And if it's not examined,
right.
you miss it.
And as we look at how pain is, we tend to see the areas that we feel the pain most at, from the point that we know from the nervous system that in proprioceptive, which is the joints, the sensation from joints, as well as pain, we have 3 trillion signals of that going up through the neck at any given second. That's 3 million, just to give you a perspective about how many those are. And really, it's filtered out that only 50 of that 3 million, only 50 of those signals actually make it to our consciousness. So many times you'll feel primarily that you have low back pain, and once that starts to get healed and start to feel better, you start to feel all these other pains around the body, and you say, Doc, I thought I was getting better. Now I have all these other types of pains. Well, it's just because now they're coming to the forefront. You're more conscious of it.
What about, would you give some discussion on acupuncture meridians and whiplash injuries?
Certainly, certainly. When you're looking at how an accident occurs, they're stretched to the front and the back of the neck in the case that we saw in the video. And if we go to some of these meridians that are along the back, I looked at the one that's in the center of the neck there, which is on the bottom left-hand side of the screen. That's the governing meridian. And you see the shaded muscle in that area. That shaded muscle is actually affected by that meridian. It's called the teres major, and that can contribute to some shoulder problems. That when you've damaged that meridian, put some congestion in that meridian area that is not functioning as well, what happens is you may have weakness of that muscle, which is a great support muscle for the rest of the shoulder. Then you look at the one that's on the right-hand side. That is the bladder meridian. And as you can see, that meridian flows down the sides of the spine, but it also greatly affects all the muscles there. They're shaded in blue along there, all along the spine here, which we see a lot of spinal injuries. Well, we also find a lot of people with problems with these muscles, and these are posture muscles too, and they tend to also get injured quite easily. And so what happens is this meridian that got stretched congestion can affect those muscles, as well as muscles that are down in the calf. And those are a great deal posture muscles. These muscles never get to relax when we're standing. The rest of the muscles actually have tendinous or ligaments that help them to relax when you're standing and you're in balance. These never relax.
Where was that teres muscle you were talking about?
The teres muscle is over here in the shoulder.
That blue one over there?
That's right.
It's part of the sits complex?
No, that's actually the teres minor. Up here is part of the rotator cuff. But this muscle here, the teres major, gives a great deal of support between the shoulder blade and the arm in its movement.
So that sits group is supraspinatus, infraspinatus, subscapularis, and teres minor.
Correct.
So that all involved in the rotator cuff injuries, and so there are specific orthopedic tests for rotator cuff injuries.
Absolutely.
They should be performed.
They should be
They're
performed.
standard orthopedic tests known by all medical doctors and chiropractors.
And we know that from that injury that you were talking about earlier, where the sternocleidomastoid affects the collarbone, which comes all the way out to the shoulder. That can affect the shoulder. And what happens is if there is bones moved out of place, or hopefully not broken, but if there's some ligamentous injury in there, then all of a sudden these muscles have to work with leverages that they're not used to, and they will get fatigued much quicker and be a source of pain also.
So treating one of those muscles or those areas without examining it first is kind of like treating blind then, isn't it?
It is.
Okay,
It
great.
is.
Thank you.
We also, if we look at here, if you look at some other meridians, the kidney meridian and the stomach meridian, which are on the front, also adds a great deal to all these muscles that are shaded here in the neck. Can be symptomatic up the upper chest.
So is it those black lines that are the meridians then?
These black lines are the meridians.
What could you explain what a meridian is then?
A meridian, what we find is actually it's a place that has lower resistance to the flow of electricity in the body.
So it's some kind of a pathway, like arteries and veins and
lymphatics. It's a pathway, and it seems to affect not only the body and the musculature a great deal, but it can also affect organs also.
And then there's an Eastern philosophy and a Western philosophy about meridians then?
There is. There is. Well, when we look at the Eastern philosophy, it's more of a symptomatology that goes along with it. It's really, when you look at the Eastern philosophy that's based on, say, acupuncture type things, it's really the same physiology as the Western. They describe the same things, but it's knowing how one affects the other. When you look at the East, you're looking at the entire body together. It's all integrated together. So that you cannot, in Chinese medicine, one needle can affect the entire body. At the same rate, you can never cut out disease from the body. From the West, we tend to isolate things kind of like a machine and isolate them. So if it's the shoulder, it's just the shoulder. But we find that when we're working on the back, say the upper neck, we find that working with the feet actually affects the neck a great deal and helps that to relax and bring about healing in that area.
And Eastern philosophy practitioners are more oriented to a cookie-cutter approach rather than doing an examination to determine if the treatment is needed?
Actually, Eastern philosophy, they tend to analyze in a different way, but it's not cookie cutter. There's some practitioners that are cookie cutter, that they do cookbook kind of treatments.
Doctor, practitioner, I heard here, so in go the needles, right?
Yep, I heard
No
here,
exam.
so this is where the needles go.
No exam.
And it's the same for everyone.
Yeah, that's why a lot of people who do have acupuncture treatment don't get well.
It's really, you got to tailor it to the individual.
That's right.
To make it sing.
Mm-hmm. But if you want to run a high volume, you just keep...
Right.
Right. Okay,
Right.
great. That's good.
Same person, same people get, different people all get the same treatment because it's all good for everybody.
No, it helps volume.
Yep, that's right. That's right. That's just passing them through. So then, let's look at the next. We're having more on strain symptoms, are not always immediate. There's some overextension of the muscles, ligaments, and tendons, but it does not tear the issues, the tissues. And in which case we can have swelling, and really, when you have swelling, it's a great part of healing. And what it does is actually sets up the body to put out more connective tissue. It's through some cells called fibroblasts. And those connective tissues, when they're laid down, as we grow, they extend in the directions of the growth or in the directions of the use, so that they're in the correct direction. And there's no connectivity between those and, say, an adjacent tissue. But when we get injured, it just lays it down as a nest, and it can go every which direction. So if you need to move a part along this way, and you have some fibers that go this way, we call that an adhesion, where it's keeping the smooth flow of this tissue in one way or another. And it
Plus
could
the
be,
chi in the meridian through the tissue then.
the energy of the meridian is normally due to congestion that has taken place. And that's chi in Chinese medicine accumulates where there is an injury, and by smoothing the flow of that is what helps it actually heal. So when we smooth the flow of chi and of the different fluids of the body, and that's where it brings healing, because we know from testing the blood that life is in the blood. Mm-hmm. So
then it becomes a specific treatment rather than, like, say, a general massage or something like that.
Absolutely, absolutely. First you diagnose and then you treat.
But then the general massage might feel good, but it's not actually helping you then.
Oh, it's relaxing, but it's not disrupting the vicious cycle that goes on within muscles and nerves and ligaments and tendons.
So the underlying issue isn't being corrected then.
Right.
Good.
Right. So if we want to look at some more ligamentous and tendon kind of injury, we can actually see those some on x-rays, whereas we look at here, we're supposed to have a nice gentle curve in here, and at first look, this might look like a nice curve to a neck. But if you look at it, we actually have a reverse curve in this area here. It's slightly indented, showing us that there's not the correct kind of motion nor posture to the neck. If you look up here, this space in between is where the disc is, and that disc is much smaller in this spot. It's actually wedge-shaped over here, denoting that there may be some injury to that. As we already know that there's tightening of muscles to pull this back. If you look at this one here, see the point here? And see where this one is kind of knocked in? So that's where we have, getting back to elastic and inelastic, this is an inelastic collision in that it pushed in the bone some. See down here, this is still square. So we can see evidence here that there was an injury in this neck, in this area, where we also have this reverse curve taking place. So that's why also x-rays are very, very important in how we can see how different injuries take place.
And also the difference between the chiropractor who does take the time and the effort to make x-rays compared to the medical facility, the orthodox medical facility, who generally, most of their x-rays are made with the patient lying supine or recumbent, which is converting from horizontal gravity to vertical gravity. So if I'm taking that spine x-ray with the patient laying down, I'm not seeing the effect of horizontal gravity. It's going all to vertical. So that's why many times the chiropractic x-ray could be the same exact x-ray, but it's going to look different than the orthodox medical x-ray, because the orthodox medical x-ray very commonly, and that includes CT scans and MRIs, that patient is often lying down, so you're not seeing horizontal gravity. You're removing the 8 to 10 pound average weight in their head when you're taking a typical medical x-ray.
And we are seeing some changes in that regard where some surgeons are demanding that they have a positional MRI because without the compressive forces of gravity through the spine, they can't see exactly what the generator of the pain is. And so that's why we do it with the compressive forces of gravity going through the spine rather than lying down or recumbent.
And then we try to do x-rays of the whole spine to see if there are any issues that are not symptomatic, that are asymptomatic, but they're not aware of, but the x-ray shows up.
Right. The spine is always trying to compensate for what's going on below it. So if you have a bad base, you're going to have curves that form in there. So we're looking at the point of injury as well as what are the compensatory mechanisms that are taking place within that spine.
That are proven through years and years of scientific study in chiropractic.
Absolutely.
Okay, great.
Absolutely. So then we have, there's another part of study with fractures, dislocations, and subluxations. We want to make sure that there isn't a fracture in there because as chiropractors, we move bones and we don't want to move bones that have fractures in them. So if we don't take an x-ray, we may not see the fracture. So to not to see is to guess. And to guess is, you don't want guesswork with your health. And so we're looking at not only with fractures, but dislocations and subluxations. Actually, the word subluxation, luxation means dislocation. A subluxation just means that there's a malposition there and that maybe the soft tissues are deformed a bit in there, but it's just not quite lined up. And when that happens, you lose the motion of the joint in there. And once you lose that, you lose the function. And then that also starts to cause pain as well as ramifications all the way up through the body. So subluxations is a great area of study for that and a great thing to be taken care of. Actually, here we see subluxations and what can occur from that. On the left-hand side of the screen, we see where we have a vertebral segment that has been moved backwards here. And you can see where we have healthy discs here in the blue. When you've moved it back and torn some of that, some of the fibers that connect the disc there, all of a sudden you have a disc that has been misshapen and has prone to injury and can then therefore start to cause many other reactions. In fact, there's a covering over that disc that is highly innervative for pain also. So that's something else that you want to look at. Also, with it being moved posterior, these holes where the arteries, veins, lymphatics, and acupuncture meridians can be pinched off. And as I said earlier, it's the vasculature that's pinched off first and then the nerves. So,
and the one on the upper right-hand corner is showing when it's in alignment like that. Now it's out of alignment.
Right, and you can actually have swelling up in this joint that holds it out of alignment.
And let's look at that next picture here. This is very often what happens when whiplash injuries aren't treated correctly or not treated at all. Often they result in spinal curvature. Is that when there is looking at a full spine x-ray of an individual, that's a significant curvature in the lumbar spine, and here they initially had neck symptoms. Well, the neck isn't badly curved, but the lower back is, and it behooves everyone then to have a good chiropractic-oriented orthopedic, postural, neurological, physical examination with comprehensive spinal x-rays if you're going to prevent a lot of future health problems. So, we're destroyed for lack of health, but we're created to live in long life and good health, and we'll see you in Session 2 of Whiplash, Injuries, Causes, and Corrections.
House Call TV has been brought to you by the Fellowship of the Great Physician. For further information, please call at 651-484-8521 or visit our website at www.housecalltv.org. Until next time, thank you for listening to House Call.